Hello everyone, welcome back to this class. We're going to talk about first aid in injuries, where we're going to look at the spinal cord injuries, bone injuries, muscle, ligament and tendon injuries. Now basically we know that first aid is that care that, or the emergency or the immediate care that we give to casualties when they are injured or when they are ill before they receive advanced care. Now injuries of this manner that we're talking about in this topic can be as a result of traumatic events such as motor vehicle accident, falls, and when you're talking of spinal injuries, mainly we find that spinal injuries can occur as a result of falls, accidents, sporting events, or any other activity. Now usually when there is spinal injury, there could be head injury too, and when that is noted, it is important to prevent further injury to the spine and the spinal cord, and that is by immobilizing the patient. Some of the risk factors are age greater than 65 years, bicycle or motorcycle crash, car accidents, falls from heights, pain in the midline of the neck, under the back or overlying the bony prominence, numbness, tingling and weakness, or intoxication or substance use, and other distracting painful injuries. Now spinal cord injury is classified into four. We have the incomplete quadriplegia, complete quadriplegia, incomplete paraplegia, complete paraplegia. Now this image here shows the areas affected depending on the level of spinal cord injury. If the injury is at the cervical 4, that is C4, then the person may be tetraplegic or quadriplegic. If it is at the C6 level, it's still tetraplegic or quadriplegic, but the level is lower than that of the C4. The C4 starts from the neck. This C6 starts slightly below the shoulder. Then from just a portion of the chest and the lower limbs are affected when injury is at the level of T6, but when you have injury at the level of L1, the lower limbs are the ones that are affected from the hip to the toes. Now generally spinal injury can be a dislocation, can be a fracture. It can be without radiographic abnormalities, or it could be penetrating injury. So spinal injuries can be further categorized as stable or unstable. Now when a person has spinal injury, some of the signs and symptoms you may see, or how to recognize spinal cord injury: the person may have pain, they may complain of tingling sensation or numbness or weakness in the peripheries, or loss of sensation, or paralysis, usually below the level of the injury. They could have impaired breathing if the injury is at C3, 4 or 5, and they could also have incontinence and priapism. Those are some of the signs and symptoms you'd see in spinal injury. Now our main focus in spinal injury is immobilization. As a first aider, the care that can be provided before advanced care is in the hospital is basically immobilization and prompt referral to the right facility to cater for the spinal injury. Intravenous fluid and medication is usually given or started when the casualty is handed over to the emergency medical team, and when the casualty reaches the facility for continued care or for advanced care. Now, immobilization usually helps to protect the spine from further injury. So immobilization can be done using a cervical collar, using a long cervical or spinal board, bolsters and tapes. And usually it is important to remove it as soon as possible, especially when the patient reaches the health facility. It should be removed. And basically, for a person or a first aider or for the care before the hospital, the focus is immobilization, monitoring the stability of the casualty, and ensuring prompt referral of the casualty. Now, when we look at bone, joint and muscle injuries, we could have various types of injuries when we look at the musculoskeletal injuries. One, we could have fractures, dislocations, sprains, strains, contusions, and cramps. Now, if a person has a musculoskeletal injury, this is the way to recognize it. You compare the injured arm or leg to the opposite one. Usually they should be symmetrical, but when there is asymmetry, then you know one is injured. And usually there is pain at the area of the injury, which increases with touch. Now, if there is a disruption of the skin continuity, then you would see bleeding from the area that has the wound or the area that has been disrupted. Now, again, if you look at the area of injury, if in case it is a fracture, you'd see this deformity at the injury site. Of course, the temperature at that site will be higher as compared to other body parts because of the inflammatory process, and there will be swelling at that site of injury. Now, they could also have abnormal sensations like numbness and tingling, and because of the pain, they might be not able to move the area. Just like I had said before, there is difference in temperature. The area that is injured could have higher temperatures compared to other body parts. Now, when you want to assess this kind of client, you can remove the client's clothes, especially if it is needed, but most of the time you try not to engage in that. But if there is need, you can remove the clothes. And in doing that, as you should be careful and not assume that areas that you think are having minor injuries are less painful, or the areas that are less painful have minor injuries. Sometimes there could be major injuries that you may not capture. Now, if the injured part has pain and the patient is not able to move it, you don't insist on the patient moving the injured part. If there is a lack of sensation, then we query that there could be nerve damage. So usually you might notice swelling, but the amount of swelling should not be used to translate the severity of the injury. Now, an obvious deformity usually is a sign of dislocation or a fracture. And when you look at the area that is fractured or that has been injured, you'll usually see a discoloration or hyperpigmentation that may resemble bruising. And in your assessment, if the patient has been bleeding, then their body may be pale, they may have bluish skin, and the skin may be cool to touch, and all that indicates that the patient may be going into shock. So it could be a serious injury. Now our approach in this kind of injuries is what we call RICE, which stands for rest, ice, compression, and elevation. Now the first that we want to look at are fractures. Fractures is breakage in the continuity of the bone. We can have an open fracture or a closed fracture. Open fracture has a wound site. Closed fracture, the skin is not broken, but there is a fracture. Now, if the fracture involves large bones, then the bleeding may be severe, and we should always be careful to note any damage to the organs which are close to the injury or the fracture. Now, when there's fracture, it is important to assess circulation, and usually it becomes the area of focus when the assessment results reveals that circulation is compromised. Now, apart from closed and open fractures, we have various types of fracture. As you can see, the transverse, where the fracture crosses the bone. Then we have green stick, where the bone is fractured but not completely. Then we have comminuted, where the bone is fragmented into smaller portions. And then we have Helen fracture. The bone is not separated, but it's fractured across. And when the bone is fractured and it tries to go into each opposite side, then we say it is an impacted fracture. Now, the general first aid for fractures is to immobilize the area, call emergency response team to transport the casualty to healthcare facility. If there's an open wound, of course, you want to treat it, you want to stop the bleeder, and you use the RICE approach. And usually, if a person has fracture, it is important to immobilize it. You can do that by splinting. Now, as we're still talking about fractures, I want us to look at specific fractures, and before then we would let's talk about stable and unstable fractures. A stable fracture occurs when the broken bone ends do not move because they are not completely broken or they are impacted. That is a stable fracture, and such are usually common at the wrist, shoulder, ankle, or hip. Usually these can be handled gently and avoiding further damage. But when we talk about unstable fracture, it means that the bone is broken and the ends can easily move. It is broken and it has separated, so the ends can easily move, and this poses the risk for damage of the tissues, the surrounding tissues, including the blood vessels and the nerve endings or nerves, and any organ around the injury site. Now, the unstable injuries can occur if a bone is broken or a ligament is torn, and such injuries should be handled carefully to prevent further damage. Now, to the specific fractures, we want to start by looking at the management of closed fractures. When caring for a casualty with a closed fracture, the aim that a first aider should have is to prevent movement at the injury site and to enable the patient to be taken to the healthcare facility. Now, that includes, at the back of your mind, you should be thinking about comfort and support during transportation. So in a case where we have a casualty with closed fracture, you will advise the casualty to keep still, and you will support the joints above above and below the injured area with your hands, and also ask someone to help in doing that if it is possible. That should be done until you're able to get something like a sling or a bandage to immobilize the area. Secondly, once you get the sling or the bandage, you place the padding around the injury for extra support. And when you are able to support that area, you find a way of sending the casualty to the hospital. Now, if if you don't have a way of transportation, of course, you could call the emergency care team, who are also equipped or will come equipped, and they'll be able to accord transportation services of the casualty to the healthcare facility. Now, if the movement of the casualty to the healthcare facility is likely to be delayed, like in our Kenyan situation, it may take 30 or more minutes before you transfer the casualty to the hospital. Then you need a firmer support to the injured limb. So that means you will secure the injured part you will secure the injured part to the non-injured or the unaffected body part. If it is about the upper limb fracture, you can immobilize using a sling. If it is about the lower limb, you move the non-injured leg to the injured one, and then you secure by folding by tying a bandage around it to help immobilize. You tie a knot to help immobilize the injured part. Now, you should also be aware that the patient may go into shock because of bleeding. Now, due to that, if you observe and see that there are signs for shock, then you treat it as such. But we are encouraged not to raise the injured leg or to elevate the injured leg. In such a case, if you need to elevate the leg because of the shock, then you will have to raise the uninjured leg, and then you continue monitoring for vital signs while you wait for help to arrive. Now, in treating open fractures, your aim is to prevent blood loss and to protect the open wound or open site from infection, and also to move the casualty to the hospital with as much comfort as possible. So in that case, when you have a casualty who has an open fracture, first you need to cover the wound with a sterile dressing or a large, clean, non-fluffy pad. Then you apply pressure around the injury to control the bleeding. Remember pressure we said earlier, you apply pressure to help in stopping the bleeding. Now, secondly, you carefully place the sterile wound dressing or more clean paddings over the area or around the dressing. Then you secure the dressing and the padding with a bandage. You tie the bandage around to help in securing the dressing firmly, but not so tight as to stop circulation. It should be not so tight to cut off circulation. Now, it is also important to immobilize the injured part just the same way you immobilized the closed fracture. Now, you also, in this case again, you also monitor for signs of shock. You continue monitoring vital signs, and again, usually when there's bleeding, you want to raise the injured. You want to raise the bleeding limb above the level of the heart. But in cases of fractures, you do not raise the injured leg, but you raise the uninjured leg. Now, as you monitor for vital signs, you also monitor the stability of the client and be able to observe any signs of shock. Now, when we move to dislocations, dislocations usually result from strong forces, and sometimes they're accompanied by fractures or other serious injuries. You'll recognize dislocation when the patient complains of pain, or you can actually see the pain from the patient's facial expression or bodily language. If there is swelling and there is bruising, and you can also see significant displacement, which can end up damaging the nearby nerves and causing serious bleeding. So when there's dislocation and you compare the uninjured limb and the injured limb, you'll find that they'll not be symmetrical. One will be deformed, and dislocations can actually be very serious, and that is because of the potential nerve damage or injury to the blood vessels. And if there's severe bleeding, we should be able to watch out for signs of shock or try to stop the bleeding, because eventually bleeding may increases the risk of the casualty going into shock. When there is dislocation, the priority in management is to first cater for the life-threatening conditions, like if there is bleeding or if there is or prevention of nerve damage. Now, after stabilizing with life-threatening conditions, then you can come and attend to dislocation. Now, this is an example of a dislocated joint. To the right, we have a normal joint which is well inserted, but to the left, we have a dislocation. As you can see, the ball is off the socket. Now, this is a typical dislocated ankle, and in managing dislocation, you should not at all try to insert back the dislocated bone into the socket, because that may cause further injury. And your focus should be to secure the injured part before you start moving the casualty. You make sure the injured part is stabilized first to avoid further injury even during transportation. And if the arm or hand is involved, then the ornaments like bracelets, rings, watches are supposed to be removed, because you expect that there could be swelling. When there is swelling, then it would be difficult to remove such. Now, when there's dislocation, something that you should not allow the casualty to do again is to eat or drink, because they might go into surgery and anesthesia may be needed. So the first thing to do, if, let's say for example, the casualty has a dislocated shoulder, you advise the casualty to keep still and help him support the injured arm in the position he finds most comfortable. Then secondly, you look for a way to immobilize the injured arm, of course using a sling or a padding or a broad fold bandage. And for the leg injuries, of course, you'll also try to immobilize using whatever makes the casualty comfortable. Now, for extra support for an injured arm, you can secure the limb to the chest by tying a broad fold bandage right around the chest and the sling. Now, it is important to arrange to take or send the casualty to the hospital as soon as possible, and meanwhile you are monitoring vital signs and watching out for signs of shock and responding appropriately. Again, in this you should be keen on circulation beyond the bandage. The bandage should not cut off circulation, and this you should be able to monitor at least every 10 minutes. Now, when we talk of sprains and strains, let's start with sprains. Sprains usually occur when joints are overextended. The typical areas for sprains are ankle, knees, wrist, fingers. Those are the most common areas for sprains. When a sprain occurs, you'll notice it by the swelling, the pain, the bruising, and the inability to move the joint. And usually it could be mistaken for a fracture, because it is difficult to differentiate between the two if the sprain is severe. Now, it is important that you check circulation, and if there is circulation is compromised, it is important to engage the emergency medical response team. Now, in managing sprain, you apply what we call RICE, That is, you rest the injured part, you apply ice pack or cold pad, you provide comfortable support, and then you elevate the injured part. So basically, for strains and sprains, it is important to apply the RICE procedure. When we have muscle injuries, we can say that they are typically caused by overextension, careless or sudden movements, and poor body mechanics. And the most common muscle injuries that you may come across are strains, contusions, and cramps. Usually, they are less serious than bone and joint injuries. And if these injuries are repeated, they could become a chronic problem. Now, muscles and tendons can at times be strained, and just like we said, a strain may occur if a muscle is overstretched, and that may make the muscles to be partially torn. And in a case where we have these muscle injuries, there could be the injuries could be in form of rupture. They could be partially, the muscles could be partially, muscles and tendons could be partially or completely torn. It can occur in the main bulk muscles or in the tendons. Now, in such occurrence, we can have deep bruising, and this is usually accompanied with extreme pain, swelling, and bruising of the surrounding tissues. Now, when we talk about strains involves the tearing, which I have just mentioned, tearing of muscles and tendons when they are overstretched, and as I've mentioned, causes pain, swelling, and inability to use the muscles. Now, these strains can usually be prevented by using good body mechanics, especially to the nursing profession where you usually engage in patient care. We should be able to involve good body mechanics in order to prevent strain, given the nature of our job, and then can also be prevented by sport safety. Now, we have what we call contusion. Contusion is a bruised muscle. It can result from a blow or when the muscles are compressed between objects, causing a blow to the underlying bone. Usually, it presents with pain, swelling, and discoloration, and this discoloration and the pain may persist up to a month. Now, we have muscle cramps. Muscle cramps involves tightening of muscles, which usually occur from prolonged use but may have no apparent cause. The most common muscles to have muscle cramps are the calf muscles and thigh muscles. They are different from heat cramps, and they can last for around 15 minutes. Usually they can be prevented by flexibility exercises and stretches. So when there are injuries to muscles or ligaments, generally you need to help the casualty to sit or lie and support the injured part in a comfortable position, preferably raised. So if there's an injured muscle, there's a strain or contusion, you lift the injured limb, then you cool the area by applying cold compressions. Remember, we said the approach in this case is rise. You cool the area by applying cold compressions such as ice packs or cold baths to the injured area, and that will help in reducing the swelling, the bruising, and the pain. Then you apply comfortable support to the injured part. Generally, you leave the cold compress in place or wrap a layer of soft padding such as cotton wool around the area. Then you secure with a bandage that extends to the next joint. If it is an ankle injury, the bandage should extend from the base of the toes to the knees. Then you support the injured part in a raised position to help minimize bruising and swelling in the area. Now, when you're bandaging the casualty, it is important also to check for circulation. You make sure the bandaging that does not cut off circulation. If the pain is severe, then the casualty may be unable to move the injured part, you can arrange for him or her to be transferred to a healthcare facility for further management. Otherwise, the advice you should give the casualty is to rest the injured area and seek medical advice, or seek medical advice if it's necessary. Now, apart from the injuries to the limbs, both upper and lower, we also have injuries to the face, facial injuries, which we will look at in our next presentation. So these are some of the references used, but you can actually get to read more about this management at your own time.